Hello, welcome to the first BDAU workshop. For those of us who don't know who we are, we're a specialist unit within the Center for Health Policy and the Institute for Global Health Innovation, and we crunch data. That's what we do. So we thought we'd share a little bit of our knowledge with everybody else by hosting these workshops. Today we're going to be presenting on CPRD, which is a data set for primary care. And Dalton will be presenting it. Dalton is our data officer within the BDAU. If you have any other questions after the event, just direct your questions to bdau@imperial.ac.uk. So without further ado, go ahead and get started. I want to turn your mic on. Yeah, cool.
Hi, good afternoon, everybody. I'm Dalton Coker. I think some of you know me. Some of you know me very well. So I'll just make a start. As Joshua said, we're the BDAU, Big Data and Analytical Unit. We crunch clinical data, healthcare data to generate greater insights and to help researchers, and sometimes just for fun. So I just want to go back a bit to provide a bit of a historical background on the use of clinical data in research. One of the earliest notable uses of clinical data to generate insights was Florence Nightingale's work with the British Army during the Crimean War. Some of you who are history buffs would know a lot more about this than myself. She put together this radial plot to show to the British Army paymasters that very few deaths or casualties were taking place in the summer months, and most of the casualties were occurring in winter, mostly December, January, February. Another key point in the use of data to understand clinical events was John Snow's work during the 1854 cholera outbreak in Soho, London, not too far from where we are now. His map showed that the cholera cases were clustered in the vicinity of the Broad Street pump and reduced in number with increasing distance from the location of the pump, as we can see here. So in the center, in the blue, that's the Broad Street pump. The red were the cases of cholera, and the other pumps are shown in blue. So that basically led to the decision to switch off the Broad Street pump, close it down, and since it was the water contained in that pump that was causing the people to contract cholera, just closing that pump ended the cholera outbreak. There you go, pioneering data analysis work. So if the CPRD data set is to do with primary care, so I'm just giving a bit of background on primary care within the UK. Again, this is probably knowledge that most of you already have, but it's worth running through for those who may not know this. The UK is ideal for research use of primary care data because the use of NHS-funded GPs for primary care is almost universal. Very little primary care takes place outside of the NHS or outside of NHS-funded GPs. So the GPs have this gatekeeper function whereby they're responsible for referring patients on to specialist care or hospital care or mental health or whatever other care they might need within the NHS. As such, a patient's primary care record through their lifetime provides a continuous care record which can be studied as longitudinal data. As I mentioned earlier, the gatekeeper nature of the GP means referrals to and discharges from secondary and tertiary care are recorded in the GP systems. So the systems, the IT systems that the GPs have hold a rich, reliable record of our encounters with healthcare in the UK, whereas in other health settings, for example the US, it's much more fragmented, and the data you have with a particular healthcare practitioner isn't as complete as you would have within the UK, because people consult different payers and providers for different issues. So, CPRD Gold, the CPRD stands for Clinical Practice Research Datalink, and Gold implements the GP online dataset. It's a clinical dataset dating from 1987 that is comprised of anonymized primary care records. It's provided by the MHRA, which is an agency of the Department of Health. Research using CPRD data has resulted in numerous publications. Each of you can go to the CPRD website and click on the biography link, and there's all the papers that have been published using CPRD data are listed. And for researchers using CPRD data, another key facet is that it can be linked to other sources of data, such as HES, hospital episode statistics, to provide greater insight into, with HES it can be used to provide greater insight into surgical outcomes. It can be linked to OMS, which is births, deaths, marriages, etc., to link the primary care data to key milestones, particularly births and deaths. Okay, bit more background on CPRD data. It's derived from England, Wales, Scotland, and Northern Ireland. It's created from the records input into clinical records by GPs. It's representative, so it's not comprehensive, but it is representative of the age and gender structure of the UK, and the crude death rates are very similar to national rates. Now, for those of you who know about GP systems, you do know that the dominant supply is IMIS, Electronic Medical Information Systems, which is headquartered up in Yorkshire. They've got about a 51% share of the market. However, the main source from which CPRD data is derived is INPS Vision. And for those of you who might be concerned about privacy and confidentiality, CPRD data does not include strong identifiers. So CPRD data, as I mentioned on the previous slide, it's anonymized and it doesn't include NHS number, your title, that's Mr., Mrs., Professor, Doctor, whatever, your name, address, postcode, or telephone number. So it's highly unlikely that even an unscrupulous researcher would be able to pinpoint individuals by using CPRD data. And this summarizes some numbers to do with CPRD. There's about 700 participating GP practices. New practices are being added to CPRD's roster regularly, so that might not be correct as of today. There's about 5.6 million active patients. As a percentage of the UK population, it's close to 10%, and there's loads of follow-up, massive amounts of data, of being able to look through the records and collate your data, and obviously link it with, as I mentioned earlier, hospital episode statistics, Office for National Statistics, and your disease registries. So that's things like your cancer registry, MINAP, myocardial ischemia national action program, your national bariatric surgery register, other disease registries can be linked to CPRD by MHRA. So for those of you who want to do studies linking databases, linking datasets, that's available to you. And this is a screenshot of the CPRD website. And as I mentioned earlier, the bibliography link takes you to the list of all the publications that have been, all the research publications that have been generated using CPRD. So, if you have any questions, please write them down and I'll try to answer them at the end. Or whatever questions I can't answer immediately, I'll give you my email address and try to get back to you within a reasonable period of time.
Dalton, can you just turn your mic a little bit? There you go.
Okay. Right. Now for authorized users within designated institutions or pharmaceutical companies or medical charities who are designated users of CPRD, that they are given access to the CPRD customer website, which includes, which gives them access to basic, to various facilities such as customer notifications, monthly release notes, training manuals, user guides, denominator files, etc. So within Imperial, I'm one of the designated FOG holders, so I can access the customer website. And as such, when researchers within Imperial need to use CPRD, I'm one of the links through which the researcher can approach myself or one of the other FOG holders and describe their intended research, and I would advise them on how feasible it is and what needs to be done, and give an estimated time scale within which their extract can be done, and advise them on how it can be used within their research. Now, that's the CPRD logon screen. And towards the end, I'll log on to CPRD and just do a couple of dummy searches and just show you one or two things that can be done. But essentially, it allows you to use your codes, so your medical codes, or that's various your codes for the disease or the or the medical substance whose effects you interested in, and use that to then define your search and then carry out your extract. Now, the CPRD software portal has two separate browser functions: the medical dictionary and the product dictionary. The medical dictionary uses med codes, which can be mapped to read codes. However, within CPRD, it's best to search using descriptive terms. So, for example, myocardial infarction, or whatever the medical events of interest might be. Within the product dictionary, that uses product codes, which can be translated into GemScript codes or BNF codes. However, when using that, it's best to search using the substance name or the product name, or you can use the BNF header, which is the product category, so the broad class of medicine. Again, I'll try to demonstrate those a bit later. So when you make the selections within the browser, that gives you a code list, which you then use to define your data sample. So I'm not sure how well you can all see that, but that was a search for using the term myocardial infarction. You can see the asterisk at the start and end of the term, and that's just a wildcard to ensure that any phrase which contains the term myocardial infarction, so either at the start or end or anywhere within the term, is captured. So those are listed in descending order of the clinical events listed within the dataset. So those, that's acute myocardial infarction, and the second one is family history of FH's family history, and it's in descending order of clinical events. On the left are the medical codes. Towards the middle you see the read codes, and there's the referral events, how many times, how many instances of referrals there are within the database, and how many tests were carried out. It's pretty self-explanatory. Right. This is a product search for metformin, which is medication used to stabilize blood glucose in diabetics. Again, I've listed these in decreasing order of therapy events, and as I mentioned earlier, there's the GemScript codes, and towards the end, that's the BNF codes and BNF headers. So there's the product names and the substance names, strengths, formulations. Is the screen clear? Okay. So what you would do at this point, so you would choose, if you are doing a study on adherence to therapy regime of diabetics, and you wanted to go back through the records of those who might not have been taking their medication as prescribed, you would select which of these formulations and strains you were interested in, and once that selection was done, you would then pop your list of codes generated into the define tool. So within the define tool, this is just a screenshot. It's possible to specify start and end date of your study, so that the period you're interested in, and other criteria. So right, when you use the define tool, you generate a patient's list. The patient's list, that's your cohort, which you then use to do the extract, and the extract is your bits of information about your cohort that you've generated. So, and the extract is within certain file classifications, listed in certain file classifications. So patient, practice, staff, consultation, clinical, additional clinical, referral, immunization, test and therapy. That's your file types, and within each there's various variables, and then that would be your data sets to go away and crunch. The extract files are in plain text format, so just basically text files, which can then be exported into your analysis program of choice, for you to then play around with and generate your findings and write your paper for your high impact journal or otherwise. So that's just the extract screen. I've chosen consultation and therapy just to expand out the variables available within each of those. But within each of these file types, they each have their list of variables, and the data dictionary for CPRD is available, and you can each take a look at it if you're interested in working with primary care data in CPRD. So, for example, within the therapy file, it has details on medication, such as the quality, the total quality, numeric daily dose, number of packs. Again, so that's on the medication prescribed to the patient. And just want to talk a bit about governance. The CPRD have obtained blanket approval for observational studies undertaken using the GP Online database, meaning that for the majority of gold studies, you don't need to seek specific ethics approval However, in the case of an interventional study, you will need ethics approval. And that would be with the hospital or trust or CCG within which the research is being done. However, that's to do with ethics, but in terms of publication, any studies using CPRD code that result in publication do require express approval of the Independent Scientific Advisory Committee at CPRD, and they ensure that they're basically a set of referees, a set of umpires who need to give their stamp and to give your study the badge of being of an appropriately high scientific standard. And they provide advice on research-related requests, such as confidentiality issues and various scientific issues, such as medical aspects, statistical and epidemiological aspects, methodological aspects. So one of the CPRD, one of the studies using CPRD that I advised on last year was a study done at the NHLI by 2 cardiologists there, and the ISAC application bounced back and forth about 3 or 4 times because the scientific advisory committee were not terribly happy about some of the statistical aspects of the study and some of the methodology used, and that had to be clarified. So it is important that while doing a study, you ensure that you've got everything clear in terms of your methods and your statistics. Otherwise, the publication might be delayed significantly. And I was mentioning linkages earlier. So the Imperial license allows users to obtain basic health data, and that consists of hospital admission and discharge dates, primary diagnosis for the admission, clinically recorded data and procedures performed. That's OPCS code for the procedures, and diagnosis is ICD-10. However, the HES linkage is England only, and only some CPRD practices have consented to the linkage. And for those of you who might want to investigate whether certain socioeconomic groups have different types of outcomes for whatever you're investigating, CPRD linked data does include socioeconomic variables such as your Townsend and your AND, and also links to ONS mortality data. IND is index of multiple deprivation, just a measure of social economic standing in terms of various aspects such as employment, education, accommodation, living standards, housing, etc. And this is a screenshot of CPRD linked health files, just showing the various files, basically, as I explained, as I showed in the previous slide. So maternity, primary diagnosis procedures, and listing the codes for the linked practices, etc. Now, I just want to go through briefly the procedure for using CPRD for a study. CPRD do offer training, and I would strongly recommend that before using CPRD data, you do go through CPRD training, either classroom-based, they do it every 3 months, or online. It's available on their website, and it's essential. It really enhances your understanding of what can be done with the resource and how it can be used for your specific research project. It's very useful to read a few research papers that have used CPRD. The bibliography lists over 1,500 papers, so you should find at least a few covering topics similar to what you have in mind. I would advise that you schedule a meeting with your institution's data manager to see the extraction tool before requesting an extract. For Imperial people, that would be normally be myself or somebody in primary care, public health and primary care. So you need to get a bit of a feel for what CPRD can do and how it can be used, and that would give you a greater understanding of how to use it in your research project. And you need to have some, okay, you'd have formulated a research question in your mind, but you may not be clear on the specific analysis that needs to be done to answer a research question. So again, this might be something that you would understand better by going through the training and looking at the extraction tool, understanding the nitty-gritty of the CPRD data. And obviously there's a wide range of software packages for analysis, and most of you are, well, all of you are highly intelligent and can zip your way through tutorials for these packages and understand how they fit within your research projects. Having said what I've just spent the past half hour saying, there are a few limitations of CPRD. So it includes the symptoms reported to the GP by patients. And those of you who are clinicians, or those of you who have been patients, would know that, well, firstly, the GPs are restricted to maybe 8 or 10 minutes with each patient, and that may not be sufficient for the patients to describe the full spectrum of symptoms they might have been experiencing. So the information within GP systems is not comprehensive. It's not absolutely catch-all, and so it might only be the tip of the iceberg. So one would advise caution in terms of regarding primary care databases as being complete, and there's been some interesting work done by Heret, and led by, I think she's called Alice Heret. She was previously at the London School of Hygiene and Tropical Medicine. She's currently, I think, at University College London. Done some really interesting work on completeness and validity of recording of events within datasets such as CPRD, and how it's advisable to use multiple datasets and link them to get a much fuller picture of what's happening within your area of concern. Now, I'll just show you the tool, but are there any questions at this point?
HES Datalink that you can have, sorry. Linking to HES with CPRD, is it possible to get A&E data as well? Or is it just patient?
No, just basic HES. So for HES and the data, what CPRD HES links to is HES inpatients. So for A&D data, that's separate. So HES data, I'll be doing a talk on HES tomorrow at the same time here. HES data is inpatients, outpatients, and critical care. It's in those separate sections, and CPRD linked HES, as far as I'm aware, mostly deals with inpatients, but I'll double check for you so I can be completely sure. Any other questions?
Yeah. Yes. Could you just reiterate the difference between the data you can get from the database as a general member of the public and what extra we get as a institution? In particular, you mentioned a FOB that you hold.
Yeah.
And whether that extra level of access has to be granted sort of per study, or whether a group within Imperial could just be given that high level of access, kind of in general.
Actually, can I comment on that? There's a couple of different questions there. In particular, your question about Imperial. So we as Imperial, through the BDAU, actually hold a gold license for CPRD. So as a general license. As a member of the public, there's no data available to anybody. So it's a paid license. There are summary statistics that are generated from CPRD that are then made available to the public.
Right. Okay.
So I don't know if that answers all of those questions.
Yeah. Oh, and is that license held by the BDAU, or is it?
Yes. So the license is held by the BDAU with key fob holders in the National Heart and Lung Institute and Primary Care and Public Health as well. So each of those departments can also do their own extracts. If you were an additional department that wanted to do your extracts, you could then pay for a key fob, but then you would also have to pay us for the contribution to the license as well.
Yes. Okay.
Okay. If any of you is interested in working with the Big Data and Analytical Unit, please send an email to that address, or if you generally want further detail on what we do, how we do it, what our purpose is, just get in contact. And okay, I will now Okay. There was something I didn't mention. To use the CPRD Gold package, you do need to install the Citrix receiver plugin. So I'm just gonna quickly install that and run.
You can close that tab and go back to the CPRD tab. And then click to the member portal again. The application portal. Dalton, just close the browser and start over again, because you've installed Citrix.
All right.
There you go.
There we go. Right. So right. As I mentioned earlier, you've got a choice of your product dictionary or medical dictionary. So if we were to decide that we're interested in a particular condition and to search using the term, would anybody like to suggest a medical condition by which to search within the primary care records within CPRD?
Asthma.
Okay. There we go. So as we can see, there's 171 codes, and if I scroll down, that's your full 171, and it's in a random ordering at the moment. So if I decide I want you to decrease in order of the number of clinical events that's done as is indicated there. And what you then do is within the description column, within the description field, having expanded that out, you then see that some of them are just communications rather than actual events. So monitoring first letter and monitoring second letter. But if you are interested in, for example, acute exacerbation of asthma and those who were given asthma management plans, and those for whom asthma disturbed their sleep, right? You select those three, and right, so we add those three to the fountain's view. What this then enables us to do is, if we select these codes, when we go to define the parameters of our search, the codes selected in the fountain's view there are the codes that will be listed in the define window.
Dalton, just a quick question. Do the read codes and read terms, are those available to the general public? So as a researcher, without having access to the member portal, could I actually look up those read codes so that if I go to you to get that extract, I already have those read codes prepared?
Yeah. Read codes are publicly available. A medical coding system that's been in use for ages in the UK.
Okay.
So that's our three codes. So right, if we were just interested in those three, we would copy those to the clipboard, and what we do next is and there we have the three codes we selected earlier for acute exacerbation of asthma and acute exacerbation of asthma management plan given, and asthma disturbing sleep. So these three codes are there, and we can then use these to if we select a data processing criteria, we can now, if we were only interested in children with asthma, so say toddlers up to 18-year-olds, we could select a minimum age of for example 3 and the maximum age of 18. Define our study start and study end period. As a default, it starts on the day that CPRD record started and ends at the present day. But if we are only interested in studying those the records that were generated between say 2000 and 2015, then we would select the year, so January 1st, 2000 to December 31st, 2015. That gives us full 15 years of records, and if we just run this, it would give us our cohort, which information about which we would then extract using the extract tool. And however, the extract does take a fair bit of time, so I will show you some files from previous extracts done. So as I said, the files are in various file types, so clinical, referral, test, staff practice, patient, immunization. Again, these are just your various file types which give you your data about your patients, and given that you can then download the files in which you're interested, take them away and do your analysis. We have 4 minutes of the hour left. Are there any further questions?
The clinical events column in the table, is that the clinical events for the year, or do you know what that number shows?
Is that the total clinical events that the database holds?
Yeah.
Total.
Yeah. So, there we have it. Bit of an introduction to Clinical Practice Research Datalink, your representative tool for primary care data in the UK. If there are no further questions, then I think that concludes our session for today. Tomorrow, same time, same place, I'll be discussing HES, Hospital Episode Statistics, which is secondary care data. Obviously, I mentioned HES quite a bit today because CPRD do provide links to HES, but tomorrow I'll be speaking about HES itself, the HES dataset that's available from the HSCIC, Health and Social Care Information Center, and that's the comprehensive HES database, and how it's collected, what it can be used for, and I'll speak about a few projects that have been done using it, and what's a few facets of it, and a couple of limitations as well. Thank you.
I'd just like to encourage everybody to come to the rest of our workshops, because we will be going into more detail about using the actual data. So this is an introduction to getting access to the data, and then we'll be showing what can be done with the data. So if you haven't signed up for the rest of the workshops, make sure that you do.